Hey everybody, we have Boris here today. He's been a patient of mine probably about, I don't know, 10 months, a year?
More than a year.
More than a year. And we were talking about your high blood pressure recently, what happens when you come in the office and when you get adjusted. First of all, in seeing you for the period of time that I've seen you, what have you noticed about your high blood pressure
It goes down after the visit.
right after the visit?
Not immediately,
Okay.
but let's say in the morning I come here for the fix, and
Mm-hmm.
later tonight I would have blood pressure's gonna go down.
Okay, and how long does it stay down for?
Um, the next day I still feel that it's not there.
Okay, it's perfect. And then prior to that, you've been taking medications for how long?
If I have a spike of a blood pressure, I'll take it for a couple of weeks. But as soon as I start coming here, it's I don't have to do it.
Okay, that's pretty cool, right?
Well, of course.
Pretty cool. So I asked you before. You said, "Hey, you know what? I know it comes from right here," and I gave you the spine to hold today. Where do you, if you want to show people,
Usually it hurts when it's high blood pressure. It usually hurts in the back of your head.
right?
But I know that it's coming like somewhere from that area.
Right.
That's where you usually work on.
Right. And what Boris is pointing to actually is the very top of the spine. It's called the upper cervical spine, into a region called the atlas or the axis. And a little bit about that area. It's a special area because it has an influence over the entire body, and it's actually what the entire parasympathetic nerve supply to the heart. There's been lots of studies at the University of Colorado. It's even made national news on how effective a chiropractic adjustment would be for lowering blood pressure. Okay, so I want to thank you very much for just sharing that today, Boris.
Sure.
Is there anything else you want to share with anybody about what care is like in this office, or about what we do to you?
I was very skeptic when I first came here, but after a couple of months, I start noticing that I start to feel better, especially blood pressure, my back, my neck, I was snoring before. Remember we were talking about that?
Right.
And after a couple of months, I was snoring less and less.
Snoring's less and less also.
So, and blood pressure, the whole thing is just, the whole experience is just out of this world.
Beautiful, beautiful. And a lot of people have a conception when you go to the chiropractor, he's going to be doing a lot of neck twisting and moving a lot of bones in your spine. Have we ever twisted your neck? Have you ever heard any?
No, but my first experience with the chiropractor was exactly the same. They were twisting my back, they were twisting my neck. Here, that was what I was expecting here, but I didn't get it. It's totally different, and it's just different.
Right.
It's never twisting.
Right. We always have your x-rays at the table. We use a special chiropractic adjusting instrument that is very precise to move those bones exactly where they need to be. And this is what we do. And we're located in Aventura. And Boris, I just want to thank you for taking time and sharing your story today.
Anytime that.